directors are supposed to be joined, but because of some work, they are not able to join with us. And from the Japaigu, Dr. Bulbul Sud Madam will join later. So directly we'll jump into our presentations. So for those participants who have joined later, once again here I'm sharing you the link where we just wanted to gather the information like what you are using during your coping during your stress level. So what are the coping mechanisms you are using in order to come out from your stress? So in that link, uh, it's already given. So on the basis of your experience you can fill it up. So we are already ahead of time. We are already 3:20. So directly we're moving ahead with our presentations. So first I would like to request Bhupan sir. Sir, am I audible? Yes.
Yeah.
Yes, sir. Thank you, sir.
Am I?
So first,
Yeah, am I audible?
yes, sir. Yes, sir.
Okay. Okay.
So first,
Okay.
I would
Thank you.
like to request Bhupen sir. Bhupen sir is Associate Professor of Department of Medicine, Greetings, everyone knows. So, sir, I request you to share your experience with our participants. So, over to you, sir.
Okay. Thank you. First of all, thanks Dr. Orbind and his whole team for the arrangement of this important webinar on mental health. I have not prepared any slide or anything, but
It's okay, sir.
what I discussed with Dr. Orbind basically last 2 years, I am preparing the duty rosters of all residents. So I know wholeheartedly their all problems and their burnout status and their all issues. Practically, I am facing on preparing the duty rosters every week. So as you know, this COVID-19 pandemic, it has lots of impact, and that all the resident doctors, they're experiencing on new level of stress across all department. And then there is a restlessness struggle against this pandemic, and this one is leading to lots of physical and mental stress. And what I personally feel that some of the departments like our medicine department, surgical department, gynae department residents, they're okay with clinical management, they're okay with management of the ventilations and all, but some of the residents, they are actually not trained in many of the clinical parts, especially those ventilator and management and all, like from dermatology department, ophthalmology department. We are posting them on duty almost every month. We are putting the psychiatry residents, SRDs on duty, and they are having lots of problems. They have to reorient themselves in the critical care management. They have to triage the patients, which they are not actually trained of, and they have to switch the patient, like which patient to be shifted to level C, which patient to be shifted level B. So it's they are having lots of issues in the management part. Second one is just one some of the has to talk with the resident doctors. Then one new resident, just I think that girl, she joined on the day before only, and then one day that Silo sir, he called me. He was on level C in search. And Bhupen, then one resident doctor, he could not come because of his illness. Can you manage one of the ZRDs for level C? So I didn't have any option, so I put that girl for level C duty. And then just I quoted her just sentence what she told me later. She was telling me like, sir, I took search from the previous ZRDs in level C. Then I didn't know how to trace, who to be shipped, who to save, who to leave. Most of the patients were around 40s, nearly 12 or 12 to 10, 12 patients were desaturating. I was totally helpless. I could not control my tears that day. Many times situations like that cannot make one, but that like so a little bit of it's like totally confused what to do, what not to do. So many young patients are there in level B and level C. and she was not knowing how to do how to give oxygen and all those things. So that was putting her lots of stress. So that is one part of the residents they are facing in the postings. Second issue is they are having that personal fear. Personal fear means like getting infected themselves or infecting their loved one or in the families. That is one fear factor. I personally, when I discuss with the residents, they are telling that, but that's I'm getting duty very frequently. So there is a high chance if I do duty in ICU, I may get infected. And my parents are there, my grandparents are there at my and then there is a chance that they may get infected. If I got infected, it's okay. But if they get infected, there is chance of they're having all comorbidities. That is another part of the story. So one is cope up with the different patient management. They are not trained for it. And second is there is a fear for them to get infection or to infect others. And third is that duty hours, because we are putting them duty hours for 12 hours duty, and lots of residents, they are complaining wearing PPE for 12 hours and then you have to go for in between break, and it's it's stress. Like every other week they are getting duties, and then 12 hours they have to be on PPE mode and all. So that is one of the issue. And we are having number if you see the total number of resident doctors we are having and total number of patients we are having, and we are having around 60s junior residents. Out of 60s, maybe 40s we posted in the level B and level C. So and that also long duty hours in frequent intervals. And with those, and that we know that in level C, patients are dying in mortality is there. So that cough up is very difficult for the residents to deal with. And that last but not the least is they are having, because they are basically that JIDs is their non-academic post, and they are all of them, they are preparing for the NEET exam. And their NEET exam is postponing on day by day. Ultimately, it will be there in the September. So that agony is still there, that we are working for COVID, but we are not actually PGs. They are doing their job, but they are having actually on duty, but we don't have any duty also. We are doing all these things, and we are not getting time for study and all. So all these things basically keeping them together for the burnout stage. And that what I feel, this is my personal point, is the worst thing is that you assure a patient that we will take care of you, knowing that he may die by next morning. When we posted in level C, many of the time we take on a handover at around 8, 9, and they're quite young patients, and they're just gasping for the oxygen. They're trying to get the oxygen. They're giving all the support, ventilation support, full oxygen and all. And it's like becoming helpless. Being faculty, we give around, and is that the worst part we are facing? And that causing this ultimately in the one, then the next day patient dies, and it causes problem we're trying to manage, but we could not help the patient. So these are the things that residents also they are facing. I think that Corbin and his team will give some idea to adopt maybe different kind of activities, or maybe relaxation therapy and all, because most of the resident doctors, they will not come themselves for these issues with these issues. So we have to help them passively, and I hope that this next few lectures will give some idea regarding different maybe therapies, not in the form of medical therapy, maybe relaxation activities and all. So with this, I'll thank again to the team for having this webinar. I think we should have this much before, we are already late, but still people are doing duty, and maybe this one will continue again for next 3 to 4 months, and we don't know, maybe by next year also. And this type of training should be continue at least once in 2 months or 3 months. Thank you again. Thank you all.
Thank you. Thank you, Rupin sir. Thank you so much for highlighting the key issues, whatever our residents are facing. So, because Arvind sir also agree with this point, like our residents are literally, they are exhausted. We do understand your problem because we know that COVID itself is a stressful situation. On top of that, like Bhupen sir have already mentioned, like you're exposing to the new environment. On top of that, your stress level related to your exam and then workload. So we do agree. So on the basis of that one only, Arvind sir have suggested to hold this webinar for you all only, so that we can we will we wanted to help you little bit also, so that your stress level have gone down to 0.01% also. That I think that will be a great for our team. So thank you, Bhupin sir. So next, I would like to request Dr. Naveen Anand sir. Sir is a SRD from Department of Psychiatry, Nigrin. So sir will present on the basis of resident perspective. So I will request Dr. Naveen sir to share your experience on the like as a resident's perspective. Over to you, Naveen sir. Sir, shall I share PPT from here, or Fira, are you going to share PPT from there?
Yeah, we're sharing from
Yes,
here.
yes. Thank you. It's visible. You just do a full screen.
Slideshow.
Yes, slideshow. Yes.
Slideshow. Good afternoon, everyone. Thanks. Firstly, thanks to the organizers and the consultants here, and also the co-residents and junior residents all here. Good evening once again. And beginning, like Dr. Bhupen Burman rightly pointed out, it was today that we all received our copy of duty rota, and I can imagine how at least 12 residents going into a state of, oh, my turn came. So that is how it was. And yeah, see, putting up a residents' perspective, have spoken to put up residents' perspective, have spoken to a few of the residents. And I think I've formulated something out of it, and that is what I will be presenting. As even Dr. Bhupen Burman also presented the same residents' perspective in his view. Let me put up my hypothesis, or kind of a synthesis that I've done with residents' perspective from a resident side. Basically, in residents and in COVID, the first and foremost thing that I have come across is helplessness. Helplessness is such a big issue that has been going through all minds among the residents, be it junior, senior, or anyone, even the interns for that matter, to be very clear. Why this helplessness comes up is, first thing, the expertise that a person has, especially when senior residents and the postgraduate residents are being posted, is they are expert or becoming an expert in one field, and but the required expertise in the postings, like when they are caring for COVID-19 patients, are completely different. This mismatch between the expertise they have or they want to gain versus the required expertise in managing COVID-19 actually has got lots of implication. First thing, they are sad on sad for not being able to achieve the expertise that they wanted. Secondly, in front of patient, they literally are helpless. They are not able to help. One thing, yes, we can actually learn new skills and give it, but something doesn't allow you so well to go out and gain that skill and start being expert in COVID. Something, I don't know whether it could, whether one could call it lack of interest in learning or something, but definitely this is what is present right now. The no resuscitation protocols, like we have seen in front of us, if like in our internship days or in the early residency periods, resuscitation is one thing. If the patient survives post resuscitation, we all get that enthusiasm to learn resuscitation and start doing it. But here, after learning, we know what is resuscitation and all, we see patients left without actually being resuscitated. We see patient giving up, and we also give up our hopes along with it. So that's one thing about it. Okay, and we have a number of publications coming up, and we have changed from hydroxychloroquine to remdesivir and currently to biologicals also. We have seen in publications something claiming HCQ is very effective, and then no, HCQ is not anymore effective. It's better to be dropped. Remdesivir, yes, it went on a spike, like everyone started prescribing, and then again it went with an evidence that it's not going to help much. So what to believe and what not to believe. And there are a number of publications. Recently, there was a report saying that COVID publications are going to take over the number of Staphylococcus aureus publications. So that is the amount of knowledge that we have right in front of us, but nothing has let hopes up. And yes, recovery rates are good in COVID, especially when it comes to Indian situation, be it in first wave, second wave, or the third wave, or how many ever in waves that is. But what that matters to a doctor particularly is deaths, and the deaths hurt more. I can recall that the number of deaths here is almost the same as what I have seen in the peak dengue seasons. Peak dengue seasons, we have seen so many deaths, we ourselves have written, but that did not feel so, it was not so hurting. But this COVID-19, yes, why along with that, there are many other factors which actually hurts more these COVID deaths than anything else. Let's see. Few of the other things are this training is not enough, or training in other subjects, like for example, like I am also posted in COVID ICUs. So I have literally no training, and I have to train, put efforts now to learn something new. And that is going to be not waste, I would call, but I cannot put it into use again anytime. So something for a short period, I'm not going to learn so easily. And yeah, we have uncertainties. What is going to be tomorrow? Are we going to continue with the same protocols like screening, isolation, quarantine, and all these things? That is on personal ground, and how to isolate family members, if ourselves from family members and such things. And with our career, like, will we be acceptable to the community with the same value as any other doctor who have completely trained only in that particular field, like psychiatrist who has done 3 years of residency? Will I be valid the same way, or I will be undervalued? Don't know. So I have lots of uncertainties like that. Isolation, yeah, we are isolated just because working in the hospitals, we can see the reactions on the face of people when you go out for a small, just on the road you travel, and you first thing that you make up is, while escaping the police, you want Negrim's thing to flash on your cars, but while in the village, just to stand on a road and take some pics, we literally hide the Negrim's logo on our cars. So that has been that is social isolation to some extent. And yeah, we are not able to freely roam around, and we are burning out. Like, we are literally taken out from our souls kind. That is what is happening. We are too much exhausted with all this COVID duties or any other work. COVID is burning us, and just we are out of out of us. So that's it. So this is what the synthesis that I would get from a resident's perspective. Thank you.
Thank you so much. Thank you, Naveen sir, for sharing a perspective point on the from the view of resident. So I think it will help our team to present in a better way or to answer whatever the queries our resident is having. So I request all the resident to freely ask whatever queries you are having, or whatever, even if you are a good techniques you are using, you can share with us, so that some of our participant will adopt your technique also. So without much delay, I will proceed further. So next, I would like to request Dr. Arvind sir. So Arvind sir is an assistant professor in the Department of Psychiatry from NIGRIMS. So Arvind sir, now I would like to give the floor over to you. Yes. Yes, screen is visible. Can you do the slides? Yes. Thank you.
Yeah, good afternoon, everyone, and good afternoon, Nanuka ma'am. Thank you very much. It's really like because of you we are having this program, and without your expertise and with all your help, we would not have shared this one. And my thing is that like this program is not just a program; it's actually something which which we have been going through, like for the last few months. I know how much I'm feeling myself. So if I'm feeling so much, then I can just imagine what our residents, or in fact, like I think we should have included the interns also, what might be going through in their minds. So with that, we thought, let's bring something. It's not just a webinar. It's not just like something which we academic or something like that. It's something which is happening, which is real, which is going on. So my idea for this program is actually, that it should help, it should impact, and it should make a difference to someone, or maybe like a majority of all of us in NIGRIMS. Although the main target audience is the residents, but I do feel as a faculty myself, I know that how much stress and like burned out and all that. I don't know. You just don't know. You don't have that feeling anymore. Sometimes you don't even know what you're feeling. So with that in mind, in fact, like I went and had a talk with our MS sir, and then and it so happened that you were there, ma'am, on that day. So immediately we decided on this program. So thank you again. I would like to again thank director and our medical superintendent NIGRIMS for giving us this opportunity. And I hope we could continue this on a daily basis. Next. So we know that as of now, as of August, there are more than 205, maybe it's just counting, 205 million and counting in the world. India has over 32 million and more than 4 lakh deaths. Meghalaya itself has over 71,000 and over 1,000 deaths. These are just numbers, of people who are being affected by COVID-19 globally. But then, if you look at it, if you look at the global situation, I think 100% of the global population is infected with this virus in their minds. So this is the reason, either like whether you have had the infection or not, but in your mind, I think all of us are infected. And one more reason for doing this webinar is that, like, if you see the graph, India graph, as you can see that we did had a very big peak. There was chaos all over the country, but then by the mid-June, things were getting much more control, and in many states, things are getting back to normal very fast. In fact, you look at Meghalaya. Okay, we had a peak, things came down, but it never really did come down. It just kept on going. In fact, like, I know I have spoken to my colleague, Dr. Bhupen and Dr. Himesh Burman and all that. Like, in fact, like we had converted many wards into COVID ward. There was a time in between where, like, these wards were again made into like normal wards. But again, we had to come back to this COVID ward. So the things are like these cases in our state has not actually come down. It's lingering. So this lingering factor could be the main reason which could give the onset of burnt out in our residents, our intern, our faculty. So it's very common for us, all of us at this point of time, to feel helpless or confused, as what Dr. Naveen has just said. The duties, we go for duty, we don't know what to do. Like I've also been in COVID duty, we just don't know what to do. It's not our expertise, so sometimes it's a bit difficult. You will get stressed if you do not know the answer of something. You will get stressed if you don't have the solution. But if you have the solution, it'll be less stressful. So feeling helpless or confused stresses us out. There could be anger. When is this going down? When is this going to end? We always ask that question. Hypervigilance to our health. Many of us, sometimes, I said like it could be a psychological COVID. After COVID duty, sometimes, like you try to suppress your cough. Or if you cough or you have some kind of like, you feel your pulse. Am I having fever? So these kinds of things going on. And most of us have just gone for testing, just out of anxiety. Feeling of loss or grief. I've also lost a relative in this pandemic, so all of us has someone who's been infected or affected by this pandemic. Overexposure to media, maybe like now it's become a bit less, but then initially that was too much. Just the media, and then, like negative news. Now it's always more news on vaccination, more negative news on vaccination rather. Difficulty concentrating, sleeping, it's common with everyone. Social withdrawal, rather than we are not even allowed to socialize. Okay, so that is another thing. And anxiety, worry, panic, this has been like a part and parcel of our day-to-day lives. So why this COVID-19 has caused so much of this problem? They are much more serious diseases like HIV, HCV, like my resident, Dr. Naveen has also said like dengue, but still, like they don't cause so much anxiety as this new COVID-19 or coronavirus as it's been caused. Mainly because they show that, different threats, they target different parts of the brain. So these novel exotic threats like this coronavirus, it raises higher level of anxiety. And they say that amygdala also plays a role in detecting novelty as well as processing fear. So many of us, those of us who have got the COVID, they said no symptoms, nothing. But then like the fear of that virus is actually what is causing most of the problem. And the mental health, one of the most neglected areas globally, and our country is no exception. But then if you look at the recent news, they say that next pandemic could be a mental health pandemic because it has affected each and every population, all the countries around the world. So coming back to basic, this fear, this stress, this long duty working hours and all that, so on and so forth, they trigger some basic mechanism of what we all are humans we have. So what is stress? Stress is actually not very abnormal. We always think of stress as something very negative, but rather it's just an adaptive response to internal or external threat, event, or change that results in physical, psychological, or behavioral deviations. So the threat, event, or change, they are called stressors, and they can be internal, like our thoughts, beliefs, or attitudes. Thinking about something can be very stressful, but even if you're not having any problem, also just the thought comes to the mind and you get stressed with it. So it's just automatic. Or some external, could be loss, tragedy, and change, which is the hallmark of all this pandemic. Loss, tragedy. The pandemic itself is a tragedy which has befallen the human race, if I may say so, and change. Who has not had to change his or her lifestyle in this pandemic? Internal stresses. This is something which actually it's within us. If we look around, we see some people are more stressed out, some people are less stressed out. You see some people, one look at the face, you can make out that they are like, like you can say that what's wrong, you can make out that they are stressed. So a choice of lifestyle which we take, maybe it's healthy lifestyle or unhealthy lifestyle, that could affect the stress level. Negative self-talk, being pessimistic, only negative thoughts roaming in our mind, that can also increase the stress level. Mind traps, repeated thoughts, mainly these negative thoughts going on in our mind, they increase our stress level. And personality traits. Each of us has different ways of different personality. You can make out some people are always positive, pessimistic. You'll always see that they're always happy, no matter what the challenge is, they always take it positively. So these kind of people, they seems to be less stressed. But those who are negative, pessimistic, or sort of introverted, they tend to take any change or any new thing as a big thing, and they tend to get stressed out more than others. So these are the common life stressors which we have to go on apart from this pandemic which is going on. The traffic, transportation problem, exams, which is upcoming, especially for the residents, training sessions, caregiving, difficult work shift, job burnout, conflict with co-workers, which is very common. Conflict with co-workers can give you a lingering stress, even which lasts for days. Forget about that period of time. Life changes, death, divorce, separation for family. These are what's going on, which you read each and every now and then in the newspaper. Unwanted transfer, marriage, childbirth, or even something positive like a vacation can also be stressful to us. Even natural influence and environmental influences, natural disasters, political conflicts, violence, hot or cold, noise level. So all these things, they are like common stressors. And what determines whether we are stressed out or not is the psychological determinants, which are the coping mechanisms which we have, the stress reactivity, our behavior, optimism or hostility, self-perception, resilience, which Madam will be talking later on, and also our intelligence, how we deal with it cognitively, how we deal with it intellectually. That also can determine the level of stress that we are undergoing. Physical factors like illness, injuries, accidents, pain, pregnancy, heart disease. So you can see like all these physical factors can be coexisting. All of us has to come to duty and all that, but most of us do have some other physical factors which adds to all this stress level. In fact, like this Holmes and Rahe has made some interesting research to see what is the maximum level of stress that a person, what is the most stressful event that the person, which causes the maximum stress to a person. So he has found that death of the spouse, which is given a score of 100, is the one stress event that is the most stressful. Based on that, then we have divorce, separation, and all that. But if you look at the tables, you'll see that most of these things, they're not negative. Marriage is supposed to be a happy occasion, or like a business readjustment, gain in financial state, or maybe a promotion. However, to the person, even these positive things can also be stressful. So what is anxiety? Anxiety is a general term for several disorders that cause nervousness, fear, apprehension, and worrying. And anxiety is more like a future-oriented mood. It's like a future. We don't worry something which is going on right now. We always worry of something that's going to be in the future. But the anxiety is always viewed as probably unsuccessful, a negative outcome to cope with upcoming negative events. So it's always anxiety that what if this, what if that happened? Usually it's always kind of a negative kind of thinking. So stress is a reaction to something happening right now. See, like maybe this presentation of me maybe is stressing me out, or maybe like just waiting for it also was stressed me out. But anxiety is something with a future oriented. What if I'm not able to do it properly? What if there'll be some criticism? What if there's some negative comments on it and all that? So you see, these things may happen. What we are anxious about something which may happen at a future date, or may never happen at all. Like if I talk to give you an example of my children, they were like always anxious about a class 12 exam. But finally, they were anxious about it, and then later on it got cancelled. You see, so but the worrying has been there from last 6 months, but it didn't happen at all only. But then the anxiety and the worry had been going on and on and on for the last few months. It is definitely taking a toll on their level of stress and anxiety also. So I can imagine our residents, they had been worrying about this NEET exam for a long time. They were many of them actually very much prepared. Then it got cancelled, rather postponed, and it's coming again now in a very shortly, in the next 2 weeks. In fact, this is another reason why we want to hold this thing for the residents, so that maybe if they can reduce anxiety or stress level a bit, their performance in the exam could improve. So stress can have several distinct causes. Usually it can happen simultaneously. But anxiety is usually one theme, it's kind of one theme which comes in our mind, and it makes the person, it blows it out of proportion. It's kind of like all or none, and it makes a person feel afraid as though he or she can't face that event in the future. Another thing, burnt out, is what we keep on hearing. What is burnout? So burnt out is actually it's not exactly a psychiatric clinical syndrome. In fact, you'll not find burnt out much in most of the diagnostic criteria, but it's actually a syndrome of emotional exhaustion, depersonalization, and sense of low personal accomplishment, or, they are characterized by These three things. So what is burnt out? It leads to reduced work efficiency, reduced work quality, and reduced work satisfaction. There are many times when we think of like, what is burnt out? Is it depression, or is it anything like that, or is it stress? You see, one thing which differentiating factor which they use the term burnt out. When they use the term burnt out, it's always occupation related. If you're like burnt out on mainly from your occupation, although I understand that there may be sometimes some homemaker, they may also be burnt out of there, but for them, like that is what they do. So this is the difference. If you have depression or anxiety, it may not be just your occupation related. It could be any other thing. It could be your personal life also. So what are the stages of burnt out? It could be like basically Freudenberger has divided into 5 stages, like stage 1 to 5. So I'll just go briefly through all these stages. So stage 1 is actually a very like initial part of the stress. There may be initial enthusiasm. There may be like initial energy, that you are facing something new, something novel. Okay, where you have like you have high productively levels at the initial stage. But then if you don't cope with it properly, it may lead to this initiation of burnout. Then you have the onset of stress, which is characterized by stagnation. Life becomes restricted to work, monotonous, personal and social priorities are neglected. Some days are difficult than others. It may take an emotional or physical toll, and it can include irritability, anxiety, difficulty in focusing, sleep and appetite disturbances, fatigue, and lower productivity. All of us could be going through some form of like all these things which we see in the stage 2. I know that like there are some days which I know that I'm not in the usual self most of the time. Like when I come to work, like the sense of enthusiasm is not there. You come to work, you get up, it's such a mundane and a sort of a, it's just like yesterday and again what you do today is exactly the same. There's no change. So it's sort of like just like a cycle. There's no change, nothing to look forward to. So these kind of things could lead to burnt out. So frustration in stage 3, feeling of powerlessness, incompetence, inadequacy, non-fulfillment, and reward frustration. Okay, so sometimes if you don't cope with it properly, there may be substance abuse, procrastination, leaving it for later, cynicism, taking things negatively, or denial or social withdrawal. Although like things are opening up, but you don't want to socialize. So this can happen, and then the stage of burnt out will occur where there's apathy, indifference, hopelessness, despair. There may be some bodily symptoms or somatic symptoms, as we call it, persistent headaches, gastrointestinal issues, and avoidance behavior. And also there's also a self-doubt, doubt yourself and your capabilities. And habitual burnout is when it's maybe like, because of this lingering problem, our COVID problem is actually stretching, for a very long time. So sometimes if it reaches this stage, they may necessitate professional help, where there's significant physical health problems and also emotional and mental health problems. So we need to screen them for mental health issues when they reach this habitual burnout. Now we come to depression. This is how we put it. What is stress and what is burnout? So if there's a lot of stress or too much stress that we can handle, that leads to burnout. Stress, as you know, is not something that we cannot handle. Stress comes, it's day to day, but we cope with it effectively. So no burnout. But if we cannot cope with it, if it becomes too much over and over, then it may lead to burnout. Depression is quite different. It's actually a clinical entity. It's a diagnosable psychiatric disorder, which is characterized by depressed mood, loss of interest, enjoyment, and reduced energy, which leads to increased fatigability and diminished activity. So there could be marked tiredness only after slight effort. So other common symptoms, these are the major symptoms, but the common symptoms could be reduced concentration, attention, reduced self-esteem and self-confidence, ideas of guilt and unworthiness, even in mild type of episode, bleak and pessimistic views of the future, ideas or acts of self-harm or suicide, disturbed sleep, and diminished appetite. So these symptoms, we can have it. All of us do have these symptoms from time to time. But to be diagnosed as clinical depression, these symptoms should be present for at least 2 weeks daily. I mean, most of the time daily for at least 2 weeks. So it's not something that you have 1 day of these or 2 days, 3 days, you are diagnosed as depression. No. So it has to be continuous before you can be diagnosed as depression. So we see stress can also lead to anxiety, which can also lead to depression or addiction, and can also give rise to metabolic disorders. So it's like a cycle. So it may start all from stress. That's why we want to target the stress, the starting point of all the problems. But then stress is not at all like, bad. So there can be some negative stress, and also there could be positive stress. Negative stress cycle is actually where you have automatic thoughts, where you have negative moods and emotion, and also negative physical symptoms and behavior. So these could lead to some kind of like, mental exhaustion, or it could lead to some psychiatric problems at a later stage. However, there's also a positive stress. There's some people who perform better under pressure. You know that, as the exam is coming, your productivity is increasing. As the exam is coming near, you could read more MCQs, you could read more pages. But then, like, if it becomes too much, then the problem starts. So positive stress keeps you motivated, makes you perform better under pressure. However, you see there's a you have to see that there's a level at which your stress level is high enough to motivate you and move you into action to get things accomplished. But if the level is too much, if the stress level is too much, your performance actually comes down. So as most of the residents are preparing for the thing, they'll know that as the exam is coming near, nothing is going into their head. Initially, they might feel that, okay, I'm reading, like, my concentration is improving. But then as an exam is coming near and near, the stress level is more, whatever they read, they might even feel that they're forgetting whatever they have read before. So you have to understand that, maybe that is a time where you need to take stock, take a break, bring down your stress level, start afresh. So this is the reason why we want to do this at this point of time. Rather, Dr. Bhupen has said that, like, maybe this is too late, we should have had this earlier. But I feel that this is the optimum time, because if we had done earlier, most of us wouldn't have feel the stress as we are feeling right now. So many of us could be having some physical symptoms, may not realize it, that is because of stress, or there could be mental, behavioral, and also emotional symptoms. So these are the symptoms like fatigue, fainting, dizziness, sweating and trembling, sleep pattern changes, palpitation, digestion changes, headaches, aches and pains, missed heartbeats, breathlessness, So all these kind of symptoms, most people or most residents and also faculty who are there in medicine department or other department, they might be getting a lot of patients who are having these symptoms. It may not be organic, but rather it could be just the symptoms of stress. That is what, if they are sent for investigation, if they come back maybe after 2 days or 3 days with the report, nothing is there. There could be some mental symptoms like lack of concentration, memory lapses, difficulty in making decisions, even small trivial decisions, which many have been very easy in the past. That decision also could be a bit difficult for people when they are actually stressed out. Confusion, which also give rise to difficulty in making decision. Disorientation and panic attacks can occur in very severe cases. So behavioral symptoms: appetite, eating too much or too little, increased intake of alcohol and other drugs, smoking increases, restlessness, fidgeting, and nail biting, very common. And also there may be bouts of depression, impatience, rage, fearfulness, and deterioration of personal hygiene. You may understand that, when you're stressed out, you don't really care what you wear, how do you look, so that these things are very important, self-care, trying to make yourself presentable, trying to make yourself neat and clean. These are things which we do on a day-to-day basis. But when you're stressed out, you just don't bother about it. So you have to tick that, you have to see that. If you really don't feel like taking care of yourself, which means that maybe you're having some problems with stress. So stress by itself is not the same as ill health, but it can also lead to illnesses such as cardiovascular disease, immune system, asthma, and diabetes. So it has direct, effect on the body. And as you see, the central nervous system, the mind and the central nervous system actually, has a control over all the body, including the peripheral nervous system, the autonomic, and also the somatic nervous system. So any disturbance in the mind by stress will affect our whole body. And the stress exposure, actually, hypothalamus is a seat where all the releasing hormones of all the physiological processes in our body is related by the central nervous system. So if a central nervous system is not 100% all right, it may lead to other physical problems. Chronic stress has been shown to lead to cardiovascular disease and other diseases. A very good simple example is that most of the students who are preparing for exam, they will see that as an exam is nearer, the flare-up of acne will also increase. So could be that the immune system has come down. So what are the indicators of mental health difficulties at workplace? It could be absenteeism, reduced job performance and productivity, changes in communication with co-workers. Could be like initially it could be a very cordial relationship with our co-workers, but now it will results in dealing with them with suspicion and also some kind of exchange of words, which will lead to a breakdown in communication, changes in mood, anger outbursts, and also crying spells in severe cases. Reporting to work intoxicated, maybe not here in Negrams, but then we may find, it's not very uncommon. If you do screening, many of them might come to work intoxicated, poor memory, restlessness, irritability, drowsiness, and impaired physical capacity and daily functioning. So mental health issues, actually they are normal people. Most of them who present with psychological issues, they are normal people. It's not that they are having some psychiatric problem, but then it's just that they are overwhelmed with an extraordinary stressor. Right now is this COVID-19 situation. So most of them have more than one psychological presentation. For example, anxious people may have features of depression, and also, they have self-medicate themselves with alcohol or other drugs to reduce the symptoms. And they may be linked to many psychosocial stressors together. It could be the work, it could be the family, it could be the problems with availability of essential commodities. So it is multiple factors acting together. But most of them recover spontaneously over time. And the presence of psychological disturbance does not necessarily imply a psychiatric diagnosis. So that most people, they don't want to come to psychiatry, they don't want to come to consultation because of fear of being labeled. But psychological problem doesn't mean mental illness. So most common presentation which we see is actually burnout, which I've already talked about. Then we also have distress anxiety related to COVID-19, substance use disorders, sleep disturbance, and also some pre-existing mental health issues. Even till today, 1.5 years into the pandemic, we still have excessive worry about contracting infection, even when all precaution has been taken. Even those people who have already had COVID-19, they are even fear that they might get a second infection. This worrying, it's not very easy to stop. Most of them, even if they don't care for their own selves, they care that, they might carry the virus to the families. I know many residents who have not gone home for months because they've been staying in the resident, what is that called? RMO. And some of them maybe staying outside, or some of them they don't, even when they stay at home also, they stay in a separate room. They don't interact much with the family because of the excessive worrying about contracting infection by themselves and spreading it to others. So feeling nervous, anxious, or on the edge, restless, that it's hard to sit still, incompetent, feeling incompetent at work, becoming easily annoyed or irritable, and excessively following social media about COVID-19, feeling afraid as if something awful might happen, lack of sleep and decreased appetite, and wants to end it all, suicidal thoughts and plans. One thing which I see, when some of us in the hospital, we fear this virus a lot. But when you look outside, when you talk to people who are not exactly healthcare workers, they don't, when you talk about COVID-19, they don't seem to be having that much of fear. They say, what is it? You just isolate yourself for 10 days, that's it. It's done. But maybe we are exposed to the people who have severe illness. They say 80%, they don't need hospitalization. But we are seeing the 20% and also the 5% who become very serious. Maybe that is affecting actually increasing or reinforcing our fear of the COVID-19, because we see the small percentage of serious people. Substance use disorder, very common in the general population, especially during the pandemic, during the lockdown and all that. So mostly it's actually stress related, and it leads to increase or change in pattern of the way of substance are being consumed. Because of lockdown, some people who are habituated to taking alcohol in the evening or night might start taking in the daytime, or they may change because of unavailability, they may change from one substance to another. For example, a very common example, supposing a person who smokes, if he doesn't get a cigarette, he might start to chewing tobacco because of inavailability rather. So, but for those who have not into substance, initiation is a bit less common. Okay, but those who are actually into substance may try some other additional substance. Because of the sleep problem, many healthcare workers, they actually take sleeping tablets without valid medical prescription, which may have some long-term consequences. And sometimes they may have substance withdrawal because if it's not available, they may develop withdrawal because of unavailability. And sleep disturbance, very common. I have lots of patients, including healthcare workers, who come to the OPD complaining of sleep problem. In fact, rather, most of the patients who had contracted COVID, who had COVID, they have also come back a lot with, now they say they cannot sleep properly like before. So there's problem with initiation of sleep, frequent awakening, early morning awakening. Excessive sleep is infrequent, but some of them, they do have excessive sleep or feeling sleepy throughout the day. So distress, anxiety, exhaustion, shift work like night duties and all that, substance use can all present with sleep disturbance. And it's important to clarify these aspects when frontline personnel report with sleep disturbances. So what is normal and what is abnormal? So you see, this is the typical example of what we see in our day-to-day, maybe like in a ward or in the COVID duty ward. We as faculty, we notice this in our residents also. So like Ms. A.H., a final year, you can see like a medicine resident who's posted in COVID management ward. Her duties include attending the infected patients, maintaining report progress, and send sample for testing. But she wears PPE all the time. But of late complains that she has been feeling a bit unsettled and occasionally sleep is disturbed, getting irritable on and off, affecting her interaction with colleagues and patients. But despite this, she's managing to carry out all her major responsibilities both at work and at home. So it's very common to see this kind of situation even in our workplace. So this case is a typical situation in COVID treatment settings. So as the subject is carrying out almost all her activities despite being stressed, her reaction can be deemed as normal. So abnormal psychological reactions are characterized by dysfunction in personal, social, occupational functioning in any or all or in varying proportions. So we know that to some level, most of us are having a situation where maybe it's not really gone out of proportion. It's just a situation which is making us like this, but definitely we need to take control of our lives. We need to change things if we feel that something is not right. That is the idea of this presentation. So mental health issues, it poses a significant risk among healthcare workers in the present COVID-19 scenario. And so we need to address these concerns to ensure positive mental health and early interventions for like anyone, for maybe frontline personnel. It could be like, even like the support staff, anyone, they can be, have problems with mental health issues. So thank you very much. I hope it's such a rather long presentation. Thanks for your patient listening. Thank you.
Thank you so much. Thank you so much for the wonderful presentation, sir. So we'll take up the discussion at the end. First, I would like to request Kimberly ma'am for the presentations. Then after that, whatever queries you are having, please jot down in our chat box. And at the end of the sessions, we will take up all your questions. So I would like to request Kimberly ma'am. Ma'am is a psychologist in Department of Psychiatry. So to present your sessions, ma'am. Over to you, ma'am. Okay.
Presentation.
So
Fira, you want me to show the slide from here? Okay. Yes, it's visible. Perfect. Thank you.
A very good afternoon again to everyone who is present. The presentation that I'm going to make is on coping and resilience. So when looking at the challenges of the profession, these are the challenges that doctors are faced with. And on top of that, with COVID-19, the medical fraternity has experienced additional challenges. There is risk of infection and transmission, and the pressure has intensified due to the protracted duration of the pandemic. So when looking at these challenges that physicians are faced with, psychological well-being is key in maintaining essential healthcare services during this time. And maybe learning to cope with stress will help us to take care of those around us and also to become more resilient. So let's look at what coping is. Coping is an effort to prevent or diminish threat, harm, and loss, or to reduce the distress that is often associated with those experiences. So coping is a vital part of human behavior. We can have healthy or unhealthy coping, but it is part of human behavior. So there are two types of coping. There is problem-focused coping and there is emotion-focused coping. So when we look at if there's a problem present, whether we can change it or not, if we can, then we use problem-focused coping. And if we cannot change the problem, then we use emotion-focused coping. So let's first look at problem-focused coping. So problem-focused strategies aim to remove or reduce the cause of the stressor. So these may include problem solving, time management, and obtaining instrumental social support. So when it comes to problem solving, we need to identify the problem first. It's important to identify the problem, to understand the problem so that we can start generating solutions or alternatives to solve the problem. In problem solving, it is also important to, if you feel it's a big problem, to divide it into smaller parts and then accordingly work on the parts so that your goal is achieved. You generate alternatives, evaluate the best alternative to use, and implement the solution. Then we come to time management. Like Sir had mentioned that exams for residents are very near. It's important for us to use time management. There's a myth about time management in that we manage time, but I think what is important is that because at the end of the day, there'll always be 24 hours in a day. So we manage our behavior so that we make the most of the time that we have. It's important, the number one task that you need to do to effectively manage time is to understand where we waste our time most. Okay, so time management, when used effectively, will give you more free time, will help you complete tasks better. So it's important to prioritize your tasks. If you look at the second picture, if it's urgent and important, so that is where you should give priorities to, and then so on and so forth. And it's also important to see the size of the task. If it's large and you know that you'll require maximum concentration, then you do it at a time when you know you're at the most productive. If it's a medium-sized task, then you should do it at a time when you're alert and also productive. If it's small or very small, then you can do it as when you have free time, then you can accordingly do these tasks. Then we move on to emotion-focused coping. Emotion-focused coping is a technique when we know that we cannot change the problem, then we use emotion-focused coping. So cognitive reframing is one of the strategies of emotion-focused coping. It's a technique where we shift or we change our perception of a problem so that we can reduce the stress caused by the problem. So cognitive reframing, it allows us to shift the way we see a problem. It makes the difference between whether or not you feel stressed by facing it. And reframing is more about seeing solutions, benefits, and new perspective. And an added benefit of emotion-focused coping is that when we change our mindset and we change the way we see a problem, it reduces the stress that we feel. And in turn, we also start thinking clearly. And when we start thinking clearly, we can also come up with solutions to solve our problems. So, for example, there's this example here. Why are difficult patients drawn to me? I should be able to go home and relax. It always turns out this way when I want to relax. But if you reframe your thoughts, then it is, you will feel the stress less. I am grateful I got to examine the patient. Think how horrible I would have felt if something happened to the patient. I would have carried guilt that I perhaps appeared rushed or distracted. And it's important with cognitive reframing, it's important that we make a note of the cognitive distortions that we have. So cognitive distortions are exaggerated or irrational thought patterns that cause people to perceive reality inaccurately. So what we tell ourselves about what we are experiencing may unknowingly contribute to our own problems. So becoming aware of common distortions will help us change them. So these are common forms of distortions that maybe some of us have: all or nothing thinking, overgeneralization, mental filter, discounting the positives, jumping to conclusions, magnification or minimization, emotional reasoning, should statement, labeling, personalization, and blame. What you need to remember also is that our thought patterns are deep and consciously developed. So rewiring them will require regular practice. And another form of another coping is identifying what support currently exists. Are there any friends and family members you can turn to with a problem? Are there other people in the community who can help? And if they're in your community, if there is an organization which can help. So then we come to resilience. Resilience is the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. What we need to remember about resilience is that it's not an inherent quality. People are not born with resilience. It can be developed, it's a process. And the added benefit is also that it can be an opportunity for profound personal growth also. So there was a study that was done to get an understanding of the coping and the support of doctors. And what emerged from the study is that it was a process, and building a resilient identity was one of the bases of resilient. So when we view this crisis as a moral obligation and a duty to serve, then physicians get a model sense of purpose, and this forms the basis of a resilient self. Along with a moral sense of purpose, physicians can also derive a sense of gratitude and hope. With help from their social connections, healthcare workers can combat loneliness and isolation. And reframing of hardships is a vital factor to build a resilient identity. So these are verbatim remarks from doctors. And so a sense of purpose, 67 said that it was this duty that helped them build a resilient identity. So remarks like, I have seen the sufferings, deaths, and griefs myself. It makes me feel I can make a difference and also save lives. So from this sense of purpose also comes gratitude to be able to be part of something bigger than us, and helping the community in whatever way we can. And then comes resilience management, or maintaining the resilience. So positivism and collectivism are powerful coping strategies which help in the management of resilience. When escape from stress is impossible, for example, when we have to do our duties, facing it helps in the process of coping, whereas avoidance makes it chronic. So this can be achieved through effective problem solving. The sick role has shown to be beneficial, creating a shield from enhanced roles and responsibilities. Here, by sick role, they mean that knowing that you are vulnerable to getting infected or transmitting it to your loved ones, it reduces the guilt that one might have, and knowing that the personal expectation also is reduced when you use the sick role. So it's also, it can't be stressed enough that building your connections is very important while working through this pandemic. So prioritize your relationships, okay? Stress can make us want to isolate ourselves, but it is important to accept help and support from those who care about you. Join a group if if you can join one. So any civic groups or faith-based communities can provide social support and help reclaim hope. And it is important to take care of yourself. Self-care is not just a buzzword. It has been proven to help with stress. So take care of your body, promote a healthy lifestyle, because it can reduce stress, and also it can reduce the toll of emotions like anxiety or depression. Practice mindfulness. It can also help to build connections and restore hope, which can prime us to deal with situations that require resilience. And avoid negative outlets. It may be tempting to mask your pain with alcohol or other substances, but that's like putting a bandage on a deep wound. And find purpose. Finding purpose, like helping others, being of help to someone, will garner a sense of purpose and foster self-worth, which can empower you to grow in resilience. Be proactive. Start taking initiative, and you will be reminded that you can muster motivation and purpose even during stressful periods of your life. Move towards your goal. Develop realistic goals and do something regularly, even if it is small, that enables you to move toward the things you want to accomplish. And look for opportunities for self-discovery. People often find that they have grown in some respect as a result of a struggle. That can increase their sense of self-worth and heighten their appreciation for life. And like has been stated before, embrace healthy thoughts, keep things in perspective, try to identify irrational thinking and adopt a more realistic thinking pattern, accept change, accept that change is part of life. Accepting circumstances that cannot be changed can help us to focus on circumstances that you can alter. Maintain a hopeful outlook. An optimistic outlook empowers us to expect that good things will happen to us, and try visualizing what you want rather than worrying about what you fear. And learn from your past. By looking back at who or what was helpful in previous times of distress, you may discover how you can respond effectively to new difficult situations. And getting help when you need it is crucial in building your resilience. So some of us might get stuck or might have difficulty making progress on the road to resilience. So it's important to remember you're not alone on the journey, and you can grow by focusing on the aspects of life's challenges you can manage with the support of loved ones and trusted professionals. And it's also important to focus on what's in your control. If we focus on what's not in our control, then the more hopeless or anxious we will feel. Focus on what's in your control, because what you do can make a huge difference to yourself, your family, and the community around you. Stay informed, but don't obsess. So check social media at fixed times during the day. Avoid checking for updates constantly. If you start to feel overwhelmed, then you stay away from media completely and ask someone reliable to share the most important updates with you. So these are a few relaxation techniques that you can do. Number one is anchoring. So one of the best ways to calm yourself down is to anchor yourself by directing your attention into the lower half of your body. Begin by focusing on your feet and how they feel inside your socks or shoes and against the ground. Expand your attention to include the sensations first in your lower legs and then in your upper legs. Do they feel heavy or light, warm or cool, tingly or numb? Now include the sensations of your breathing, really relaxing as you breathe out. You can do it anytime with your eyes open or closed, while sitting or even while walking around. Next is muscle relaxation exercise. So you can either sit or recline comfortably with your eyes closed. Tense up one set of muscles, for example, arms or legs. Now let them go limp. Notice the relaxed feeling. Move on to another set of muscles, such as your back, stomach, or face. Now let them go limp. Repeat for all muscle groups. Then we have visualization exercise. You sit or you recline comfortably with your eyes closed. Use one of the above exercises to relax yourself. So for example, the muscle relaxation or the anchoring. And when you are very relaxed, visualize yourself in a favorite place where you feel relaxed, peaceful, safe, and tranquil. Imagine the sounds you can hear, the fragrances you can smell, how it feels to be there, and the relaxed body sensations. For a couple of minutes, just stay in that peaceful place, enjoying these sensations. Imagine how you look while you're there, feeling peaceful. Allow your mind to come back to the room you're in. Move and stretch a little, open your eyes and feel alert and refreshed. So in all of this, remember that you are not alone and we're all going through this difficult and challenging period. So if you need help or you can be of help to someone, remember to do so. Thank you. Ma'am, kindly unmute because we cannot hear you. Ma'am, we still cannot hear you.
Am I audible now?
Yes, you are.
Thank you, Kimberly ma'am. Thank you so much for your presentations. So now I would like to now Bulbul ma'am Sud has joined from the Japaigo team. So Bulbul ma'am is a senior strategic advisor in a Japaigo. So ma'am, I would like to request to say something to our participants before taking any questions from our participants, ma'am.
Anuka, let's first have the question.
Yes, ma'am.
Afterwards, okay?
Okay, ma'am. Okay, ma'am. Thank you so much. So now floor is open for the discussions. Any of our participant would like to ask anything related to the topic or related to our discussion. So floor is open for the discussions. I have not seen any questions in our chat box. So anyone wanted to, even if anyone is wanted to share their experience, because you know these are stressful situations, and if people are facing stress, how you are coping of your stress during that stress time, what are the coping mechanism you are using. So you know, if you will share in this platform, might be some of the people who are not using or not knowing what to do, might be they will also get benefited. So I request any of the participants to share your experience. Yes. Dr. Himesh sir, you want to say, you want to share your experience, like when you are facing any kind of stress. So what are the technique you are using? So during this time.
Hello.
Yes, sir, you are audible.
Thank you, Anuka, and thank you, Department of Psychiatry, for holding this. I was really looking forward to it, and I actually come to learn few things, how to understand all this. So that was quite great. And only thing I want to say that means for residents, I think what Naveen was the perspective that Naveen shared really made sense to me, because most of the residents now, they have joined NIGRIMS for their certain goals, which could be enhancing skills or something else. They had something in mind when they came to NIGRIMS, but what they came here expecting, they probably are not getting that. They are pushed into something which is quite different, and they didn't want this in the first case. So they do not value this, and obviously they will not value, because suppose a resident which unrelated to emergency intensive care is required to go into an intensive care, so they're not valuing it. And I understand that it's difficult for them also. At the same time, many residents probably don't want to continue this and they want to leave and then do something, but they are obviously, for obvious reasons, administration has not been able to release them also. Again, they sort of have a feeling of getting stuck over here. So those are a few things we can't help. But one thing I think what is important is most of the residents who are having most of these feelings that been described today, they are not even realizing. They know that they are not feeling normal, something is wrong with them, but they don't know what is wrong with them, and they probably do not know how to where to go, whom to talk to, how to seek help. So that's a very important thing. And for burnout, I think we need to pick up for these residents or whoever, even faculty for that matter, preemptively before they actually are into a full-blown or later stages of the thing, and then try to remedy under whatever resources we have to do something remedial, and then probably this can happen. So I think I don't know, I wouldn't want to know Dr. Arvind's opinion, but I think we should have more awareness among faculty and also especially heads of the department, so that they can be mindful of the mental health of their resident. They can preemptively pick up people who could be under stress and maybe take something remedial at appropriate time. So that's what I have in mind.
May I just, yeah, this is exactly, I think Dr. Himesh Burman is exactly echoing my thoughts when I discussed this thing with Ma'am Nanuka. I said, like, okay, fine, we are targeting the residents, but the faculty are also, they should also join. Main thing is that, like, the faculty needs to know also. That's why I told them faculty also should join. Maybe they are not the target audience, but then they should know. I cannot address directly to faculty and say this and that. You understand, no? But we as a group, the faculty, we have to be the one who are mentoring our students, our residents. So I thank you again, Dr. Himesh, that at least you have joined, and Dr. Bhupen is there also, he has also joined. But I had wished other faculties also, who have their residents, because every time, one of my residents now is having COVID duty. He's a junior resident posted, and for the last 3-4 months that he's posted, I have had interaction with him for hardly a month. Most of the time he's in COVID ward. So we as faculty, we need to understand. We can be their mentor. We can understand them, because we as a department, although we try to reach out, but it's difficult for us because of stigma and all other related issues. Many people, they don't come to us, and if they come to us also, maybe there's a limit to how much we can help them. But yes, the faculty, if they are on board, each and every faculty of each department can do a lot to help, reduce the stress level of themselves and also the residents and also all the healthcare workers involved in their department. It's a collective responsibility, I feel, right now.
Okay. Thank you, sir. I think thank you, Himesh sir, also for bringing this point. I think on the basis of this one, I think, Arvind sir, we will host this webinar frequently, because this is not a one-time thing which we are hosting. So we will plan ahead, and on the frequent basis of time, we will host, so that, if the few participants who are not able to join today because of their duties hour, might be they will join in the next time. And at least one method also, if they will adopt to deal with their stress, that will be also a great achievement for us. So thank you, sir. We will do this one on the regular basis. Thank you. Any other participants? Dr. Wanglang, ma'am, you wanted to say something, or you wanted to share your experience? Because this group we have kept short, so that we can have a more like one-to-one kind of interactions. So that is our main objective. So that's why we wanted to make it a small group. Bhupen Burman sir, you wanted to add something?
No, I think already Dr. Himesh and Dr. Arvind, they have covered only most of the things. I think, but I have not seen the ZRDs here in the group. So
Yes.
most of the things normally it covers by junior resident doctors. So if we can involve the ZRDs and from their perspective, if we allow them to speak rather than asking questions from representative from the junior resident and intern, because they are
Yes,
also
sir.
posted there, so they can. I think the next meeting we can, if we can have representation from senior resident and from the intern,
Definitely,
it will be
sir.
good.
Definitely, sir. Thank you. So, Dr. Sakti, Dr. Anna, Yasmin ma'am, anyone wanted to share any experience like how much stress you are
Uh,
facing and what are the technique you are using?
yeah,
Yes, sir.
Yasmin,
Yes, Bhupen sir.
Yasmin is there. Yasmin,
Yes, Yasmin is there, sir.
Yasmin, can you? Because she is Yasmin and Gwen, they are managing medicine department for last 3 months. Every alternate day they are doing duty.
Both of them they
So,
are there, sir. Yes, sir.
Yasmin,
Yes, Yasmin, I have seen your hand raise. You can
yeah,
unmute yourself.
Wait,
yeah,
yes, sir.
yeah. Yasmin, please share your experience, because you and Gwen, you are managing last 3 months every alternate day. I don't know how. Please
Yes,
share your experience.
uh, uh, Dr. Naveen, Dr. Irvin, and even just like you have mentioned it, sir, and Dr. Himesh also, it is stressful because, like Dr. Naveen said, that helplessness and that fear that we cannot go home because we fear that we might give it to our loved ones. That is one main thing, sir, that is affecting us. And since we are seeing patients on a day-to-day basis, so deaths, yes, do affect us a lot. If especially there was that time when we were managing level C and level B together, and there were a number of deaths. That time I think was the most stressful time for me because there were a number of deaths at that time. Like every day, 2-3 patients would die. So it was very depressing to actually see patients dying even after us giving a lot of effort and not being able to save them. So, but now, sir, I don't know, maybe we have come to terms with it that this is what we have to do. So we have been, I think right now we are quite used to it. I think it has become a habit. So now we are just managing it. And since now we are managing that level B and patients are not really dying there, so maybe a sense of satisfaction is there that patients are actually going home. So maybe that is helping a bit. But yes, sir, it is stressful that we can't take breaks and maybe leaves are difficult because just the both of us are there. So if one of us goes, then the other person is overburdened. So that is there, sir. But I think we are coping. Both of us, I think, are coping well enough because we are used to it now.
Thank you. Thank you, Dr. Yasmin. So on behalf of Nigrin's teams, Dr. Nigri, Dr. Yasmin, and Dr. Gwen, we really appreciate your hard work, because last time when we are discussing planning for this webinar, also Dr. Irvin that time telling how they are doing continuously for 3 months. So we really appreciate your hard work and your continuous effort that you are doing in this situation. So we really thank you for that, and we really appreciate your hard work. So Yasmin, I wanted to ask two questions, like one question. So during the peak time when you really facing lots and lots of stress, so what are the two things you are adopting to cope up with the stress? So during that time.
For during that stressful period, like I think like the psychologist ma'am, she was speaking that time, that I think for us not to stress ourselves out too much is when we feel that gratitude while working and when we have that feeling of actually helping people at that time. So I think that really helps because though we were like physically stressed and mentally when patients die, but then At the same time, there were patients when they would recover, who we were expecting might not make it, and then they would make it. So I think these small things, which give you that happiness that, okay, at least I could save one life today, like the one we thought would not make it, but then when they make it, I think that was there. And then our consultants at that time also were very supportive. Like even they would give their everything, helping to get the patients the best. If we faced any problem at that time, like even Dr. Yada, there was a time when there were a lot of patients and very sick, critical patients. So I think that time we managed because our consultants like Dr. Bhupen and all of these, like they always come whenever we call them, or so that support was there. Like if we faced any difficulty, that support was also there. And when a patient comes out of that critical situation and they get to go home, so I think that helped a lot. And our colleagues also are always helpful like that. That way, since our own medicine people have always been ready to help, like JRs or PGs, if we are too stressed, we send them. So I think all that helps. And maybe I think just we have to go with the flow, I think, because this situation is like, we cannot change it. We know that there are cases, we expected the increase in the number of cases. So I think we prepared ourselves mentally that yes, it will be stressful, but it will be for a short time. So we have to cope up with that. So I think when you don't have a way out, you just have to work around it and just to try and keep yourself mentally healthy, I think, and physically also. So I think that's what we did.
Thank you so much. Thank you, Dr. Yasmin. I think because of your three tips, changing mindset, changing attitude, and also getting satisfactions after giving care to your patients, and also having a friendly coworker environment. I think these three tips which you have adopted is really helpful, and I think most of our these participants will also get benefited from this technique. So next, I would like to request Dr. Gwen Andrew, sir. Sir, can you please unmute yourself and share your experience with us?
Good evening, everybody. Well, I would totally agree with what Dr. Yasmin has said. We've been doing almost alternative duties we started in April, and I think alternate duties for almost 3 months. And the problems that we have faced, she has already described a lot. But one other thing which we both used to discuss a lot is like, because we have alternate duties, we tend to forget on the day that we are off also that we are not off. So sometimes we just wake up in the middle of the night thinking like, why isn't my phone ringing, why is there nobody messaging me regarding reports and all, and then it'll take some time to realize, okay, it's not my duty today. So we get kind of confused. That is one thing that both of us has faced, which maybe I don't know, maybe Arvind sir can help us with that. And when patients go back home and they give their gratitude, that helps us a lot. It builds up our morale to keep serving the patients who are suffering from COVID. And in relation to coping with all the stress and everything, I feel some other thing that I always try to do is to do something which is completely not related to hospital work or the subject or medicine. So something like, picking up, learning some new hobby, taking a walk, drawing something, painting something, that really helps take your mind off, even if for a few hours. So maybe other residents can also take up something that they are interested. They can build their hobby that way. Though maybe the time is very less, we really do not have a lot of time. Half the time we get off, we end up sleeping only. But then the remaining little hours that we have to ourselves, I think, build focus on our own self, our own personal growth. That is also important. So yeah, that's what I wanted to share. Thank you.
Thank you, Dr. Gwen. Thank you so much. So yes, I also wanted to share one experience. Last month I was doing a webinar in international platform regarding a self-care. So in that, when we are doing that time, we came to know, like, forget about this thing, self-care. Even when I was trying to find out the research study related to self-care in India, it's very hard. Rarely 2 or 3 study I got during that time, because for the presentations I need to prepare for the self-care, and I was searching how many research studies there related to self-care. as per my experience during that time, I found like, self-care is the most least untouched topic I felt during that time, because of my presentation only, that time only I was also going through what is self-care and what are the techniques that we are using, and I was searching a research study related to the self-care. Other than that, so I also even don't realize that people, they are not giving importance to the self care. So it was really surprising. And thank you, Dr. Gwyn, because like Dr. Gwyn ma'am has also experienced, like, in self care also they have mentioned कि when you please take care of yourself, because even in the flight also, when we see, when they will instruct, so they will say, no, first put oxygen yourself, then only put to the baby. So that means, if you are not good enough to take care of yourself, then it's not possible for us to take care of others. Because, for example, if today I'm mentally irritated and I'm not feeling good, even some people will share a good news, then also I'll have a negative thoughts inside my mind. I'm feeling so irritated and they are so happy, and why they are telling me the story. But if I'm in a good mood, and if I'm very much happy, then even if some people who will share their very bad experience also, that time also we can give a very good feedback, and we can, listens, and we can support them also. So I think self-care is really important. Thanks to Dr. Gwen ma'am for sharing, like, how to take care of self-care, how to take care of ourselves during this stressful situation. So thank you, Dr. Gwen. So anyone wants to share, because we got four new points, like, which we can use during stress time. So anyone, Dr. Sakti ma'am, Dr. Wangla, Dr. Nang, Dr. Anna ma'am, anyone wants to share your experience, any technique, any methods, or what you are doing, or how you are feeling, anything you can share with us. And by the time, like, I think Dr. Gwen has asked one questions to Dr. Arvind, like, during the middle of the night also she's getting up and she's checking. So in these typical situations, like, how she will manage, or what she can do. Dr. Gwen, if I'm not wrong, I think this is the things you want to ask Dr. Arvind.
Yeah, because we keep doing duties, no? So sometimes it gets really confusing. Sometimes you feel like you're on duty and then you're not, and sometimes you tend to sleep off more than required, and you miss out some calls or something. It keeps happening to both me and Yasmin. We both have admitted to it.
Rather the question being asked to me, I always discussed it with Bhupen. I think we should learn something from Gwen and Yasmin, how to cope, how to cope with stress. Because, I'm also, like, I'm part of this contact tracing. So contact tracing, whenever a patient is positive, I get a message, and then we have to do the contact tracing. We are a team, so we get a message. And every time, a thing comes in my phone, I feel like I hear something, I check my phone, nothing. I discussed with Kim also. I said, see, something is wrong on my phone. I hear a beep, I hear a message, I check, nothing is there. And suddenly I realized, like, am I getting just some kind of hallucination or what? Like, that really struck me also. Because I'm so, like, it's actually anticipation, because our stress level is very high, is very high. So, what happens is that when your stress level is high, you're always on the edge or on the go. You understand? No? That is what the stress does to us. Up to a certain point, that on the edge, that on the go makes us alert, make us becoming more productive. You understand? No? If you're too relaxed or you're sleeping, you might not be able to get up, next day for your own duty in time. But like, even when she goes to sleep at night, the situation is such that she knows that, if I don't get up on time, if I don't go reach my duty on time, Yasmin will have to do extra duty. Maybe that anticipation. So already, like, she's before sleeping, only the anxiety level is on the higher side, that I have to get up early in the morning. My alarm is out. So whenever this thing happens, like, your sleep also, it doesn't go through the deep stages of sleep. So you have a more of frequent, rapid eye movement sleep in order. So that is what happens. Maybe you start dreaming. So when you dream and then you get up and suddenly, you have just a recollection. You feel that you have not even, like, completed the day yet. So sometimes it's very difficult to differentiate what is real, what is in the dream. So these things can happen, and that could be because of the stress level. It doesn't mean that, it's a negative stress, but it means that you are, like, you're geared and ready to go. That is a kind of thing. So It's okay, like, it's quite normal to be having feelings like that. Many things are normal that we are going on day to day. It is not exactly so, but then, if you tend to think of it that, okay, I will do something to get a good restful sleep, you sleep deeply, then maybe you will not get up at all in the middle of the night, and if you want, I think maybe we can share the sleep hygiene tips. So how to get a proper restful sleep, because if you use social media before sleeping, that actually disturbs the sleep. Even when you get sleep, it stays in the very, like light sleep stage. So even when you get up, although you have slept, you will not feel refreshed. Hope I answered the question.
Thank you, Dr. Arvind sir. I'm not expertise in this, but I also wanted to share a one point. I have studied somewhere, but I'm not sure whether I'm correct or not. So one thing also we can do, before sleeping, either you do the meditations or you just repeat the word. Like I just it's simple, kind of like tomorrow is my over, or do some kind of meditations or repeat something like before sleeping. So I heard, I studied somewhere, like before sleeping, whatever thoughts you will have inside your mind, so during the sleep also this kind of thoughts will also play a big role. So I have studied somewhere else, but I don't remember where. But doing a meditations or relaxing your mind before sleep, might be it will also help you, Dr. Ben. This is just one point. Yeah.
Yeah, meditation is always something that I always do.
Great.
It's very, like, breathing exercises are something that keeps you grounded when when you tend to go when your mind tends to go beyond what is required, when you overthink or when you get too stressed. I think everyone can practice this. You just have to take a minute of your time and just take very deep breaths and just focus on your breathing. That really helps everybody calm down, or like stay focused again. So yeah, that's what I also incorporate into my daily whatever I do to help cope with all of this, including taking a walk, playing some music and all that.
Thank you. Thank you
Yeah.
so much. Okay, Dr. Sakti and Dr. Anna, ma'am, can you also share your experience, because you are also doing continuously COVID duty? So any of you also, can you share your experience with us, Dr. Anna, Dr. Sakti, or any of our participants you want to share? Yes, Dr. Anna. Yes, you are audible.
I don't know what to say actually. But, it's a very different. We are not on call. We are actually right there only. So, and we basically have to run around a lot of places. It's not only in one area also. So it's little different for us. And some of the ways that I have been trying to cope over the past 1 or 2 weeks is maybe taking a time off in between, like maybe 5-10 minutes every hour, doing some breathing exercises when it gets a little more hectic. And and trying to not to think much about what went on in the duty after the duty gets over. Yeah, so that these are some of the things that I have tried.
Okay. Thank you, Dr. Anna. So now I think we are end of session. So before ending, I would like to request Bunul ma'am to say something to our participants. Over to you, ma'am.
Thank you, Malika, and good evening, everyone. I don't have words to express, gratitude to each one of you who have been working, round the clock for so long, and hearing from Juan and when Yasmin was talking about their experience, that they've been doing alternate duties for last 3 months and they haven't been home. I can just imagine how strong they are. In fact, I would like to say congratulations to them that they've been going through this and are able to talk about it also. I think as everybody, Arvind and mentioned, everybody said, one, the stress is it's normal, I'm saying if we expect that we are not stressed, then also I would say there's something wrong, because this is not the normal way that all of us, spend our weeks after weeks, and managing critical care patients day in and day out, and seeing someone, despite all your efforts, lose a life is not the easiest. But at the same time, there are days when you feel gratitude also, when you feel that you have been able to save. So the feelings is a mixed feeling, which will be there with all of us. And as I said, that you are very brave, but at the same time, you are also brave to admit that there is a stress and that you need to have something, something has to be done. And the solutions are also there. And I'm sorry I couldn't join in from the very beginning, but I heard, when they were talking about how you can do your time management, and how to make yourself resilient and all those things. I would say that you are already, the solutions are with you. Most important is that have a support group, and I think sometimes it's very important for the faculty. So say faculty is connected with 4 or 5 residents, then it becomes a smaller group where you can keep interacting and just checking on how you are feeling. And if they also feel after some time more residents feel more comfortable talking to the faculty. So that is one suggestion that I would have, that if you can make, with the faculty, and I see some faculties already there, but maybe have a teacher and students kind of, so 4, 5 with one, that would help everyone. One, you would also know what are some of the challenges the residents are facing, and residents also know, go-to person. The second thing, as everybody also said, that there are other things that we have to do. There are, and you are already doing it, whether it's yoga, whether it's meditation, whether it's, trying to do something else, gardening. I've found that, doing gardening is very therapeutic for me. I'm sure some would be finding listening to music is very therapeutic. Somebody may be thinking, just painting or something is very therapeutic. So I think each one will have something which takes your mind off, what's happening around. Second, at least I see that I talk to my friends, and doesn't have to be always, people related to your work, but even outside of. So try to, call, and now it's because you can talk, you have even people outside India, so video calls are, so if you have friends, just pick up phone and talk to them instead. A lot of time I've seen people spending a lot of time on the WhatsApp, sharing messages. I think I find it's easier to just pick up phone and talk to another person for 5 minutes. You are connected. So that way, since we are not able to go out, and especially like I heard people say that who've been doing continuous their residency, where alternate day they are at the place of work, but they have not been home. So just pick a phone and talk to people. That is a good way. Media is a very dicey kind of a thing. I think I always find it's easier to just listen to maybe for some time, but not constantly, and not definitely before sleeping, because the negative news is something which really stays in your mind. And when you are sleeping, you never have a very peaceful sleep, and then once you get up, or sometimes you may have dreams and other things. So stay away from, I think just before sleeping, listen to good music, having some chanting going on in the room, some is much more helpful. And I think you are already being very honest about saying that there is the stress is there, and we have to find a way out of it, is a very positive thing, because many times people don't want to admit that there is a stress. They don't want to admit there are challenges that people are facing. And so I would just congratulate everyone to say that this is something which is a need. And as Nanuka, you were saying, you can have some sessions, some relaxing sessions, maybe once in a week when people can just join, and it could be either through Zoom or in person. I'm sure that those can be also arranged by the staff. We are in this together, but I know we will find a way out also. Look at the brighter side that think of the positive side of that now more people are vaccinated. The number of cases, especially in the Northeast, is going up, but the mortality rate, I'm sure, is down, and we have to fight this together, and I'm sure we will, and I'm confident everything will be much better soon. So thank you very much.
Thank you so much. Thank you, ma'am. Definitely, we look after this thing. We look after about this things point. So we will definitely will update you soon, ma'am. So I think now we are at the end of our session. So anybody who wanted to add any points, then welcome. Otherwise, we are going to end our sessions. Yes, Dr. Sakti, I have seen your hand raised.
Thank you for the wonderful session from psychiatric department. I just wanted to add one thing, that a token of appreciation after the hard work will literally change the whole mood and attitude of the resident. So I told to our HOD, our Himesh sir, the same thing. Giving a token of appreciation is literally it blows off the mind. So I like to add that one, so to our seniors and our associates, and I mean our all consultants, that after the hard work, if you give an appreciation word, it'll be very good, so that it will give us a boost our confidence to work well. And one more thing, my personal thing is, I don't take anything personally. I Whichever is personal, whichever is professional. That is my attitude. So I just wanted to share it. So that's it from my side. Thank you so much.
Thank you, Dr. Sakti. Yes, Dr. Bhupen sir, you want to
Yes,
add?
sir. Regarding this point, already we have a discussion with MS sir in the MS office regarding that giving token of appreciation to the residents and the faculties. This one already I have a discussion with the authorities to go for it.
Thank you, Dr. Bhupen sir. I hope, Dr. Sakti, you got your answer. So, yes. Okay. So I think now we have come to the end of the sessions. If anyone doesn't want to put any point, then I think we will end the session because it's already 5. Thank you. So thank you all the participants. I especially wanted to thank you, Dr. Arvind sir and Kimberly ma'am, for coming forward and thinking about our residents and plan for this webinar. So thank you, Dr. Arvind sir, for this in picking up these points. So that's why I'm able to chip in with you. So thank you so much, and thank you all the participants for joining with us. Though we are half an hour ahead of the time, because even though you have stayed with us and you have shared your experience. And once again, I would like to thank you, Dr. Yasmin and Dr. Gwen, for your hard work. And thank you, all the participants. Thank you, Dr. Himesh sir, Dr. Bhupen sirs, and all our participants. And thank you, Bulbul ma'am, for being with us and sharing your experience with us. Thank you.
Thank you.
Thank you so much. So, thank you. I'll end the session now. Thank you.